For 50 years, University Hospital has been the home of groundbreaking discoveries and cutting-edge medicine. Since its opening in September 1972, patients have relied on its physicians and staff for their comprehensive and compassionate care. From the beginning, people were excited about University Hospital's potential and how it would contribute to the study of medicine.
The whole city was excited about this place.
Time went on, and as it unfolded, we began to see blueprints and so forth. We had a big discussion on who should open. We decided it had to be somebody in the medical field who was highly esteemed. Dr. Wilder Penfield, who was North America's renowned neurosurgeon, who was doing things in the brain that no one had tried before. And he came from Montreal and cut the ribbon, and a gold key actually is what it was to open the front door.
So as the opening weekend started, the lineups, they were out the front door, down University Drive to Windermere. And we opened the hospital with a big bang. It was exciting.
In time, it became known as the medical hub for not only Southern Ontario, but for Canada. And people like Dr. Henry Barnett and Dr. Charles Drake had moved up to establish a neurological center, including state-of-the-art, big-time neurosurgery. And that was the keystone at the beginning. And then more specialties evolved.
And yet it felt like a family. You know, I felt like I belonged here.
I think the other really important part of the hospital and why it functioned so well was the administrative approach to things. Everybody knew they could just, if they had a problem, they didn't like something or wanted something, they could just walk downstairs and talk to Pat Lewitt or myself or Diane.
It would make it easy from a teaching perspective, from a research perspective. It also led into the design of the physical footprint, whereby these physicians who signed on to be part of the faculty at Western and the professional staff at University Hospital would have at their disposal everything that they needed to be the academic physicians that they were meant to be.
What was unique at UH was the offices, the clinical areas were co-located, very close. So you got to work very closely with your colleagues.
They had access on the same floor to the clinical inpatients, the outpatients, and to the research facilities that they needed to be able to contribute to the body of research that created some of these incredible innovations.
Our clinics, our patient care area, and our research area all adjacent. And so there wasn't any waste of time traveling across the city or things like that.
Now you've got all patients for transplant in one area. Because even though the organs are very differently, the surgery is very different, treatment's the same as far as drug. It was really good to have them all in one area.
Just based on the system they had at University Hospital, like orthopedics thrived, but if you look around, all the groups thrived. Like neurological sciences thrived, Dr. Wall and Dr. McKenzie, Dr. Stiller, the transplant program.
It made it very worthwhile work because these patients would have died if they weren't saved by transplant. You know, they got a new life.
It was a wonderful model to stimulate research, like making things better. It was a magic time.
We felt privileged to be able to work there, and we did become a family.
There's gems in every single pocket of the clinical teams that are part of the secret sauce of University Hospital as a research-intensive academic teaching hospital.
I felt privileged to look forward to coming to work every morning. I mean, I loved my job.
You know, from the cardiacs to the neuros to the orthos, it's just been a trip down memory lane that reminded me about the gem that University Hospital was and continues to be as far as clinical excellence and in service to our patients. It's phenomenal.
We have a legacy in London of greatness in healthcare, and University Hospital has been a major part of it, and for 50 years it's been a beacon, a special place. And I'm very proud to have been part of University Hospital and now LHSC for many years.
I see that the future is very, very bright for all of our teams and what we are going to continue contribute to the body of knowledge and experiences for students, great care for our patients. Nothing is going to change because we continue to attract the brightest, the most talented people who are committed to that vision of being in service to our patients and our community. The rich history of University Hospital and our clinical teams is only going to continue to unfold now and into the future.